Hey everybody, we are back in the shanty. Why are we back in the shanty? Well, I work in the shanty. But we're back in the shanty because it's Tuesday. We always do these. We film them on Mondays and we publish them on Tuesdays, but today is actually Tuesday, and we waited till Tuesday because we were expecting news from MIOSHA. You might remember that last week in a press conference, the governor said she was going to lift all of the rules, COVID rules, by the 22nd instead of July 1st, which she had originally planned on doing. And that raised a lot of questions with everybody because she was talking about the MDHHS mask order and what was going to happen with the MIOSHA emergency rule. And we had reached out and we had been told that we could expect something from MIOSHA today. And we got something from MIOSHA today. And that's why we're back at the shading. We're going to talk about that. So I went back and I looked. And we started these things back in November. And we've done 20 of them. This will be the 21st, I think. And all but 2 of them have been on COVID. And with MIOSHA's announcement today, this is it. We're done. Hopefully. Because we did get that announcement from MIOSHA on the emergency rule, and it is probably, for most of you, going to be very, very good news. Let me read to you from the press release that we got from Lara today. It says the following. Today, the Michigan Occupational Safety and Health Administration filed COVID-19 emergency rules to align with federal OSHA's emergency temporary standard. The updated rules are effective today and set to expire December 22, 2021. The rules rescind the emergency rules issued on May 24, 2021 and focus on healthcare. So, that's the important part. The rules rescind the emergency rules issued on May 24, 2021 and focus on healthcare. And this is the point where the confetti should be shooting up behind me and the balloons should be coming down and we should all be having a celebration because of that sentence right there. So let's go look at the rules. The rules, the new rule, the one that was published today, and it is published, and it doesn't have an effective date on it because it's not effective till it's filed with the Secretary of State, but we're going to go with what the press release says that it says, which is that they were filed today. So they're effective today. The new rules are considerably shorter than the old rules. No big surprise there. They've been getting smaller from 15 pages to 6. We're now down to 3 pages, and there are 2 rules. Let me just say that once again, because that's lovely. 2 rules that we have to worry about. And I'm going to read the first rule to you in its entirety. Rule 1, suspension of previous rules. These emergency rules supersede the entirety of the emergency rules filed on May 24, 2021. What does that mean? That's lawyer speak for saying the rules on May 24, 2021 are gone. And they're replaced by these. And replaced by what, you might ask? Well, if you're a non-healthcare employer, they're replaced by nothing. Because that's the whole rule. Now, there is a second rule. I told you that, 2, right? 2. But the second rule only applies to healthcare employers. And what the second rule does is it incorporates into the Michigan rules a bunch of federal rules and standards and regulations. So now, if you are a healthcare employer, you have to comply with the OSHA rules because they're now incorporated into the state rules. The most important of those is the COVID-19 emergency temporary standard, which we did an e-alert on a couple of weeks ago, so you should go look at that. But if you are a healthcare employer, you should go look at that emergency standard so that you know what applies to you. Or give us a call and we can talk you through it. So there are still rules for healthcare providers, but there are no rules for non-healthcare providers. They're gone, right? There's no rules left. Oh, wait a minute. There's still a rule. There's still OSHA, the MIOSHA. And the general duty clause is still out there, which means you have to provide, as a general rule, a workplace free from recognized hazards. But that's the same rule that has applied to you since the standard went into place and you started doing business. So this is good news, right? So let's flip back to the press release. Now, by the way, healthcare providers, healthcare employers, I'm going to focus on non-healthcare employers in this podcast. Sorry about that, but that's the way we're going to do it. So let's go back to the press release. The press release says the following, quote, dialing back workplace rules for non-healthcare settings allows employers to use their best judgment in determining whether to maintain daily health screenings, face covering requirements, and social distancing requirements. Nevertheless, MIOSHA strongly encourages workplaces to follow the available CDC and OSHA recommendations to mitigate hazards. And then it goes on to say the following, quote, non-healthcare settings should align policies with CDC guidelines to ensure they help contain the spread of COVID-19. Federal OSHA has updated guidance for non-healthcare employers as well. And federal OSHA does have updated guidance. It's out there if you want to go see it. That is guidance that applies, in OSHA's own words, to non-vaccinated people, not to vaccinated people. And that guidance does have, for example, a recommendation that non-vaccinated people continue to wear masks. But that's guidance. It's not a rule. It's not a regulation. It's guidance. So if we go back to the press release and we go back to the MIOSHA rules, that means it's up to you whether to follow it or not. You have a general duty to provide a safe work environment free from recognized hazards. MIOSHA can cite you if you don't, but you no longer have a requirement to make people wear masks. That's the question you're all asking, right? Do we still have to wear masks? The answer is, it's up to you. And the press release specifically calls that out. You get to use your best judgment in determining whether to maintain daily health screenings, face covering requirements, and social distancing requirements. It's up to you. What's not on that list of things there? What MIOSHA didn't say is you don't have to maintain a preparedness and response plan. But the requirement to maintain a preparedness and response plan was in the emergency rule. Now, OSHA's wanted you to have a preparedness and response plan since the H1N1 outbreak in 2009. Raise your hand if you had a preparedness and response plan before COVID. You didn't. I virtually guarantee that. Should you maintain a preparedness and response plan? Now, I think you should, all right? But it's up to you. I think if MIOSHA comes in and they get a complaint and they come in to investigate, it would be really nice for you to be able to say, well, wait, we still have a preparedness and response plan. So if I think you should maintain a preparedness and response plan, it's not required, but I think you should. What should that preparedness and response plan have in it? Should it be the same one we have right now today? No, it shouldn't be the same one you have right now today. It's got to be modified. And it's got to be modified to take into account whatever it is you're going to do going forward. So some things you want to think about in that is, what are you going to do for people who come in and are positive, come to work and are positive? What are you going to do for people who have this principal symptoms? What are you going to do about notifying close contacts? What are you going to do about general cleaning? What are you going to do about cleaning after a positive? And what are you going to do about training? Are you going to continue to do training, or aren't you going to continue to do training? What kind of training are you going to do? So those are things for you to consider. Now, the reason why I think you should continue to have a preparedness and response plan is because you've already got one. It's there. Why not keep it? Why not have it on hand? You don't want to keep the same one you've got now. You do want to modify it for your new set of protocols. We can help you with that. Give us a call. Send it to us. We'll fix it up for you. So that's where we are right now. Boom. That's it. We're done. But wait a minute. Are we done? Well, we still have some rules out there. What rules do we have out there? Well, we've got that state statute. Don't forget that state statute. Remember, go back and look at the last shanty that we did a couple of weeks ago. Remember the shark going behind me? Yeah. Those state laws, that state law is still there. And that state law, remember, protects employees who don't come to work if they're COVID positive, or if they have the principal symptoms of COVID, or if they're in close contact with somebody who has COVID. That's a law. That's not part of these rules. And it's still there. And I told you that 2 weeks ago. I was being, who's that guy Johnny Carson used to be with the turban and he told the future? Karnak. That's it. I was being Karnak the Magnificent. How's that? I'm dating myself. Now you know how old I am. So that's where we are. That's what we've got. I guess we're done. Maybe. Now, you and I both know that the pandemic's not gone away. And could we see another spike? Hopefully we won't. But this isn't over. But on a day like today, when the sun is shining and the breeze is blowing and the birds are singing, it's pretty easy to get positive. So hopefully, cross your fingers, we're done. And this is the last one. And when I say, by the way, when I say that, I don't mean the last shanty. I mean the last shanty on COVID. So if you have any questions, if you want us to help you with your preparedness and response plan and you decide to keep it, or if you have any other questions about what you should be doing or how to go ahead and do it, we've got an e-alert out on this, which I'm sure you've all seen, or you should give us a call. We'll be happy to help walk you through the process. We'll be happy to help you modify your preparedness and response plan and answer any other questions you might have. I hope you have a great and wonderful day. I hope this is a great day for you. I hope it's a great day for your employees. And we'll see you in a fortnight.